medicine physician working out of South Beach Health Center. And today I'm going to be talking about diabetes complications, mainly the chronic complications of diabetes. Last week we discussed acute, which was a very nice, short, and quick topic. This one is a very long topic. So we'll try to see how quickly we can actually go through it. As everybody knows, diabetes is a metabolic disease classified by when persons have high blood sugar, resulting from problems with either insulin secretion or the action of insulin on the body, or a combination of the two. And when the sugars are high for a long period of time, it can actually cause long-term damage in the body through the various organs where it goes, where it be the kidneys, the brains, the blood vessels, the heart, all over. Some of the symptoms that you may feel with diabetes are in the brain. You may be lethargic or feeling tired all the time. You may actually have blurred vision, a fruity flavor on the breath. You may have weight loss, problems with your breathing, nausea, abdominal pain, or you're urinating more frequently than usual or more thirsty than usual. So with those things that can happen with diabetes over long term, like I said, anywhere sugar can go or anywhere the blood goes can be affected from the diabetes. So that's from head to toe. So it can cause problems in the brain, leading to strokes. It can cause problems in the heart, leading to heart disease. It can cause heart attack. Cause problems with the kidneys, leading to dialysis. Can cause problems with male and females in terms of sexual dysfunction. Mainly for males, it causes the erectile dysfunction. It can cause problems with the circulation in the blood vessels, which we call peripheral vascular disease, when you can actually see darkening and swelling of the feet. It can also lead to actually infection because of decreased sensation in the feet. So you can step on something, not recognize it, leads to an ulcer, spreads, unrecognized when it's found out if it's in the late stages. It can possibly lead to amputation of that part of the body. So because of all these complications that they do exist, we want to try as much as possible to control the diabetes and keep it controlled to actually prevent these complications from happening. Now, last week this was we discussed the acute complications when the sugar is too high, the ketoacidosis and the hypoglycemic non-ketotic syndrome, and also we discussed when the sugar is too low. Now this week we're going to discuss the chronic complications. So the chronic complications are many and varied, but they're actually divided into two types. Two types which we call microvascular, and the second one is what we call macrovascular. Only difference is one of the big vessels and problems with the small blood vessels. So in terms of the big blood vessels, there's three organs that we're worried about. We're worrying about the brain, which can cause cerebral vascular accidents or strokes. We're worrying about the heart, which can cause heart attacks. And we're worrying about the big blood vessels in the legs, what we call horse circulation. Also in terms of the small blood vessels, the three things that we're worrying about are, we're worrying about the nerves, when it can cause some numbness, tingling, and all of that. We're also worrying about the kidneys, which it can affect. And last, we're worrying about the eyes or retinopathy. So those are the organs that we're mainly concerned about in terms of the diabetes, in terms of the complications. So, in terms of the small blood vessels, like I said, there's three we're going to talk about. One is the retinopathy, which deals with the eyes. Two is the nephropathy, which deals with the kidneys. And the third one is the neuropathy, which actually deals with the nerves. Now, in terms of the nerves, because nerves are all over the body, it can actually affect nerves at anywhere of the body. Mainly affects the nerves in the distal parts, in the fingers and in the toes, but it can actually affect the nerves that supply the stomach or any other part of the body, causing problems once the diabetes is uncontrolled. But if the diabetes is controlled, then that likelihood is just the same as it would be for anybody else. So now we'll go on to talk about the nerve problem. So we have a good nerve and a bad nerve. What happens normally is this long filament or fiber that you see here is the actual nerve. Around the nerve, you have something what we call the myelin sheath or covering, which is a nice thick cushion that actually helps and provides some insulation to the nerve and actually adds protection to the nerve. On the side of that, you see the blood vessels which actually go to the nerve and actually supply the nerve with oxygen and nutrients so the nerve can actually function appropriately. And this is how it's supposed to be normally. The problem with diabetes is one, because it causes damage to the blood vessels. When the blood vessel starts to be damaged, then it cannot properly supply the nerve with the energy, the nutrition and the oxygen that it needs. So what eventually happens is the myelin sheath, which actually protects the nerve, starts to die. And eventually you start to have damage going on to the nerve because the nerve isn't getting the adequate supply of oxygen and nutrients. When this damage starts to happen, that's when you start to feel actually tingling and numbness at the tips of the fingers. The reason to feel it at the tips first is because how diabetes works, it affects the nerves at the distal ends because they are the smaller nerves and the ones that are more readily to be damaged. And then it gradually moves up. So we usually say it has a glove distribution because it starts at the tips and gradually moves up. Or it has a stocking distribution where it starts at the toe and then gradually move up. So if you have some numbness or something going on and it just starts in the arm or in the neck, then it's highly unlikely that it's actually due to the diabetes and it's due to some other cause. Now, like I said, with the nerve damage can actually affect anywhere. We have one what we call sensory motor neuropathy. What it actually deals with is it causes problems with movement and it also causes problems with feeling or sensing. So what it means is that something can actually be hot and you put your hand on it and you can't sense it's hot. And it can actually cause you to have burn. That's come a lot of the times. You see a person has diabetes and their diabetes are poorly controlled. We ask them not to put their feet or anything in hot water because they can't sense the temperature of the water and the water may be too hot, and when they take it up, they just see boils and blisters on their feet because the water was too hot, but they actually couldn't feel it going on. Also, the diabetes can cause problems with nerve entrapment, which means that it can cause persons to have carpal tunnel syndrome, or when you have the nerve which runs through here, the median nerve, to be compressed, and it causes you to have numbness and tingling of the fingers, especially in the night when you wake up in the night having to flick the hand or hang the hand down low. It's usually secondary to carpal tunnel syndrome. And like I said, a lot of these things can happen to persons who do not have diabetes. But if you have diabetes and the diabetes is uncontrolled, then your risk of having these conditions is much higher. Now we talked about this, but in terms of the pain, there are different things that you can have. You can have numbness, you can have tingling, you can have loss of sensation, or you can have a problem where the pain is out of relation to where it was given. Meaning that if I touch you here, just like this, a tap, you start to scream because the pain is actually heightened and aroused because of it. So all of those different things are affected. Like I said, the feet are mostly affected. The hands can be, but usually not. And in patients with problems with diabetes, the main problems is with sensory just the touch or the feel. So the main problem you have is with feeling rather than with movement. So the problem when you have conditions where you actually can't feel or sense when you step on things, it can actually lead to you stepping on something, having an ulcer, and because you can't feel it, unless you check your feet on a regular basis, you won't know that is actually happening. I had a client one time who has diabetes, and what happened was, went to work, put on his shoes, all day at work, no problems, came home. When he went in the bathroom, the bed, he actually noticed blood. When he actually checked the bottom of his foot, he noticed that he had a cut and an ulcer. What had happened was one of his children was playing somewhere, and one of the jacks actually dropped in his shoe. But because he couldn't sense or feel when he put his foot in the shoe, he didn't know that it was there. I spent the whole day just walking on it, walking on it, walking on it. But he couldn't feel, so he actually couldn't feel the damage that was being done. So it's good, especially if you know that you have damage to the nerves of the legs every day. You actually have to check your feet to make sure there's no damage or nothing going on. If you see any cuts, any bruises, any bunions or any corns or anything, just to make sure, take note of them, look at them, see how they're going. And also if you wear shoes, to check your shoes before you put them on, especially if you have nerve damage, to make sure that there's nothing that can actually drop in them, but you might not actually notice. There's rocks, pebbles, all of those things can actually happen. So this is what happens with somebody who has nerve damage with a diabetic foot. First you have an ulcer. Ulcer is just a cut that's actually on the top. After, what happens is it leads to an infection and ulceration. So it actually starts to go deeper into the layers of the skin. So on the outside, you may only see a small hole like that. But that doesn't mean that on the inside there's not a larger damage that is occurring. That's become a lot of the times when persons are diabetic and have any type of ulcer, we like them to get properly reviewed, have the x-rays and everything done, so we can actually see the extent of the infection to see if it's actually spread and gone anywhere, because it can move and go into the bone, which is a bigger problem. Because what happens is it leads to the toe being infected, leads to it actually having to get amputated and actually cut off. So we actually want to reduce the amount of amputations that occur because of diabetes. So it just gives you different things that can actually risk factors for problems with diabetes foot. You have the fungus, you have the ingrown toenails, you have the hammertoe, the bunions, the skin spots, the corns. Sometimes with shoes, especially with the ladies wearing these tight shoes, it can actually cause blisters and calluses, so you also have to be careful of all of these things. Not wearing tight-fitting shoes, especially if you're wearing them for long, extended periods of time, because they actually can cause damage. So, what this is this just talks about a different type of nerve damage, what we call autonomic neuropathy. What this basically says is the nerves which we actually cannot control. That's where it causes problems. So it can cause problems, for example, this one, the gustatory sweating. So that one can actually cause you to be more, if that nerve is damaged, cause you to actually be sweating more profusely. It may be in a cold room with air conditioning and you're actually still sweating. It can also cause problems, like I said, with the nerve in the bladder. So with this, you can feel when your bladder is full, and sometimes these persons just urinate and don't know they're urinating because their bladder is full, and then it just actually leak out. And sometimes it can cause problems what we call gastroparesis. So it causes damages to nerves in the stomach. So for these persons, sometimes as soon as they eat, they start to vomit, they can't keep anything down, they have a lot of problems. A lot of the time that happens in persons more so with type 1 diabetes as opposed to persons with type 2 diabetes, but the possibility is still there. We know with the men it can cause damage to the nerve in the penis, leading to erectile dysfunction, where you actually either can't get an erection or the erection you get is not maintained in order for orgasm to happen. So a lot of the problems that can occur are many and varied with the nerves, so we actually want to try and protect the nerve as much as possible. And we discussed this a little bit earlier when we discussed the nerve problems that it can cause with the carpal tunnel, but any nerve in the body can actually be affected from the diabetes. So in summary, nerve damage is common complication for persons with diabetes, and it can result in significant morbidity. Morbidity is basically your quality of life, meaning that your quality of life won't be the same. You can't do the same things that you used to do. If you can imagine if you can't feel or sense or feel things as much, it'll be more difficult for you to be in the stove, cooking and everything else like that. Just you put your hand in the paper, you may be touching something hot but not realizing it can cause burns and different things going on. So diabetic neuropathy, as we say, can present in many different ways because the nerves goes anywhere. So any one of those nerves can be damaged, and the main cause of it is actually high blood sugar. So the main focus is actually controlling our diabetes, controlling our blood sugar. Once our blood sugar levels are within normal range, our A1C is 7 and below, then our risk of these complications are the same as anyone else. So like we know, the nerve damage has bad consequences. It can be prevented, and prevented in only one way, and that way is to actually control your blood sugars. Now, once the nerve damage is present, it can only be managed symptomatically. So once the nerve damage is there, we can only manage it depending on which symptoms you have and treat the symptoms. But it's very difficult to actually repair the nerve damage. Because if your nerve is damaged, the nerve actually, if it has to regrow, it regrows only a small amount every year, probably like 1 to 2 millimeters, so that's only this amount every year. So imagine if you have this amount of nerve damage, that can take up to 12 years for just that amount of nerve to actually grow. So the best thing is to actually early diagnosis and aggressive management to actually prevent it from happening. If it does happen, then prevent it from progressing and getting worse. So we've talked about nerve damage. Now we're going to go and talk about problems with the kidneys. So diabetes has actually become the most common cause of end-stage renal failure in the US and in Europe. And we know for the Bahamas itself, a lot of our persons who are on dialysis, one of the reasons is because of the diabetes and it being uncontrolled. So they also found out that about 20 to 30% of the patients, so persons with diabetes, actually develop some evidence of kidney disease because of the diabetes. Now in terms of kidney disease, it can be varied in terms of the degree, but the majority of persons end up with some damage to the kidneys. And the prevalence of problems with the kidneys is actually higher in persons who are black rather than persons who are white. So for the Caribbean folks, it's actually even more imperative for them to actually control their blood sugar level. So they actually did a study where they actually saw persons who actually had kidney disease and tried to find out what was the cause of their kidney disease. So when they did this study, they actually found that 44% of the persons who actually had problems with their kidneys, it was actually related to diabetes. They also found that 26% of the persons who actually had problems with their kidneys, it was actually related to the high blood pressure. So you can actually see that about 70% of kidney failure is actually caused by diabetes and high blood pressure. 70%, which is a lot. That's the reason why if you have diabetes, we want to control. If you have high blood pressure, we want to control. And if you have the combination of both diabetes and high blood pressure, which could be a double one, we definitely want both of those controlled to actually prevent you from having damage to the kidneys. So, when we talk about the kidneys, what happens is everything happens by actually causing damage to the blood vessels. So once it starts to cause damage to the blood vessels, then the blood vessels that actually supply the kidneys actually start to be damaged, and it leads to lack of blood to the kidneys, causing the kidneys not to be able to function as good as it can function, and also leads to the kidney actually having a smaller size and not being able to filter the blood as good as it's supposed to. Some of the things that you may notice if there is problems with the kidneys is one, edema, which is just swelling. So persons may notice that their legs are swelling, and the kidneys can actually be one of the reasons for that. Two, they may find out if you do a urine test They may find microalbuminuria. What that is that you're spilling proteins in the urine. An easy way or spot test to find out if you're spilling proteins in the urine is when you urine, there's supposed to be, sometimes there's bubbles that form. If the bubbles stay and don't disappear, then that can indicate that the kidneys are likely spilling proteins and that you may have damage to the kidneys. So that is one way where you can say, okay, boom, I think I need to go to the doctor, ask him to check my urine, see if there's any protein or anything. But persons with diabetes, at least once a year, they're supposed to have their urine tested to actually see if there's any protein spilling in it. And it can actually lead to full-blown kidney failure. So some of the risk factors for kidney disease, or risk factors are basically things that make it more likely for it to happen. So some of those things are, we divide them into two. One is modifiable and two is non-modifiable risk factors. Modifiable ones are things that we can actually change. Non-modifiable ones are risk factors that we cannot change. So one of the risk factors that we can't change for kidney disease is age. As we get older, just with everything, the normal kidney function just declines for anyone, whether you have diabetes or not, just for regular wear and tear. So gradually over the course of your lifetime, the kidney function will gradually decrease. It will still stay within the normal functioning range, but it will decrease over time. Also ethnicity, as we said, persons who are Black or African American are more likely to have kidney disease. And also persons who are actually male are more likely to have kidney disease. And those are the things that we can't change. The things that we can change which can actually cause problems with your kidneys are one, your sugar control or your HbA1c level. That's why we want everyone with their HbA1c to be 7% or less to prevent this damage from happening. Also, your blood pressure can affect it. So we want your hypertension or your high blood pressure control. And as we saw in the previous graph, it showed that 26% of the problems with kidney disease was actually caused by high blood pressure. So we know that it takes a major role in it, so we want to control. Another problem is your cholesterol level. So we also want your cholesterol control. And the last two are if you're obese or overweight, and also persons who smoke can actually higher risk for damages in kidneys. The reason with smoking is that smoking actually causes damage to the blood vessels, causes them to shrink, increasing your risk for having problems with the kidneys. So a lot of these things we can change, but some of these things we can't. But the things we can change, we want to actually optimize to actually reduce the risk of problems occurring with the kidneys. Now if you have any questions, please feel free to ask. Now, in terms of management of persons with problems with the kidneys and dialysis, what we actually usually do is if persons are over 40, have diabetes, for most of them, we usually recommend aspirin once a day to help with the blood vessels, help reduce the risk of kidney disease. We advise you against smoking, and we also tell you to exercise more, which actually helps with blood flow and everything, helps it to work better. And we also want you to control your weight and control your blood cholesterol. So at least once a year, your doctor should actually check and see what your cholesterol is to make sure those levels are within normal limits, and if not, do something to actually treat it to put it in the optimal levels. Also, like we said, the blood pressure has to be controlled to actually protect the kidneys. And also the ACE and ARBs are certain medications that can be used for persons if you have damage to the kidneys, or persons who are diabetic if you have high blood pressure, which actually one helps to control your blood pressure, but two also helps to protect the kidneys and actually make it last longer. Also vitamin D and also control of your diabetes can be used. Now, like we said, aspirin a day helps, no smoking, exercising. All of these can actually be a way to keep your blood sugars under control. It requires a lifelong strategy. Everything that we try to get you to do is supposed to be something that you do over a lifetime, something that actually becomes part of your routine. not a fad diet or something that you do for 2 or 3 weeks and then you go back to normal. It's supposed to actually put you in a new way of life. In terms of your diet, we want you to avoid excessive sugar, avoid excessive salt, and also avoid what we call trans fat or bad fat. Trans fats are usually found in a lot of snacks and everything else like that, like chips, cookies, all of those things that everybody loves. A lot of them have a lot of trans fat, what we try to avoid. And also, if you drink, we want you to slow down or stop. If you don't drink, we don't want you to start. But if you do drink, we say no more than 2 alcoholic beverages at most per day. And good?
Yeah. No, I just thought you were promoting red wine for that.
So we actually want you to have gentle aerobic exercise. The exercise actually depends on you, depends on your lifestyle, depends on your weight, depends on what all you can do, depends on any other comorbidities that you may have. If you have heart problems or anything else, the exercise may differ. And also dependent on if you have any type of nerve damage from the diabetes, then we may prescribe a different type of exercise for you. But you should try to get exercise in most days of the week. And as there's 7 days of the week, most days will be at least 4 days of the week for exercise. And as we know, smoking actually increases the risk of having problems with the kidneys for diabetes, with persons with diabetes. So we actually want you not to smoke. So we talked about 2 of the small vessels. That was the nerves and the kidneys. That brings us to the 3rd small blood vessel, what we're going to talk about, which are the eyes. So diabetes can actually increase your risk for problems with the eyes. The 3 main things that it can cause is it can cause glaucoma, or pressure to build up in the eye. It can cause cataracts, or what we call a clouding of the eyes. And it can also increase your risk for something what we call diabetic retinopathy, which means it damages the blood vessels in the eyes, leads to bleeding, eventually causes further damage, and actually leads to blindness. A lot of it, as we said with everything else, is caused by poor control of your blood sugar. So the main focus of everything is to get you to control your blood sugar. The more your blood sugar is controlled, the less likely that these problems will occur. Also, persons with diabetes should have at least 1 yearly exam every year to check their eyes, where they do a dilated fundoscopy, where they look at the back of the eyes, where they look at all the blood vessels in the eye, to ensure that there's no damage occurring to the eyes. And if they actually see damage occurring to any of the blood vessels or anything, they actually catch it quickly to optimize it before the problem gets worse than it is. So in terms of the retinopathy that we discussed, there are different stages of it. Basically early and goes straight to the late stage, where you actually have loss of the vision itself. And you also have glaucoma, which can occur when you have increased pressure in the eye. So what happens with the retinopathy? As you see with everything, you have the eye, the macula, optic disc, and you have all of the blood vessels that actually supply the eye and go to the eye. What happens with the diabetes and this uncontrolled, it actually starts to damage the blood vessels in the eye. So in this first diagram, you see all the blood vessels look nice, flowing good. In this diagram, you actually see that some of the blood vessels are damaged, and you start to have some bleeding spots that are actually occurring. So what happens is with the sugars being high, sugars being uncontrolled, it starts to damage the blood vessels in the eyes. When it starts to damage the blood vessels, it actually leads to bleeding. When it starts to cause bleeding in the eye, what happens is the body tries to correct it, because if this blood vessel goes all the way here and then gets damaged, so it's cut off here, so this part is not supplied anymore. What the eye starts to do is form other blood vessels to actually try and supply the part that was actually cut off. what happens with that is you have a bunch of abnormal blood vessels which actually form, and these blood vessels are not as durable as the original blood vessels, and that leads to further bleeding and everything of the eye. So the mechanism that the body tried to do to actually help the situation starts to cause further damage in the body, which can actually lead to you actually having a cloudy vision. You can't see or focus on things as you would usually see or focus. So they said that diabetic retinopathy is the leading cause of blindness in the Western world, and then mostly in the working population, so that's young persons who are able to work. The prevalence or the occurrence of it actually occurs more likely with the longer duration of you having diabetes. The reason they say that is the longer somebody has diabetes and is uncontrolled, that means the longer your sugar is uncontrolled, the more likely you are to have damage from the elevated blood sugars. And they usually say some persons can have damage within as little as 5 years if they have diabetes and their blood sugar is uncontrolled. So persons who actually have type 2 diabetes, as soon as you find out you have diabetes, you usually refer to an ophthalmologist to actually start to, one, have your dilated eye exam to see what damage is there, if there is any, and then to see you on a yearly basis to actually prevent any damage and make sure everything actually stays controlled. So, this just shows basically what happens when you have the blood vessels and you start to have bleeding and hemorrhaging in the eyes that actually start to occur. And sometimes blood vessels actually start to dilate and get bigger, just try and supply more parts of the eye. And then what actually eventually happens is it leads to more abnormal blood vessels forming, which actually start to distort the eye, cause problems with vision, and you can't see as much. You start to see other things in your vision, and can actually eventually lead to blindness. These dots that you actually see here are actually dots that were quote unquote man-made. What this is something what we call photocoagulation. That is something that they actually use to burn the back of the eye to actually try and reduce the bleeding that is there. So the treatment that they have for the diabetic retinopathy only tries to slow down the process, but it actually doesn't cause it to be reversed or prevented. Only way it can be prevented is by proper control of your blood sugars. So that is the reason why we want proper control of your blood sugars. And this just shows someone who actually has a bleed that occurred in the eye and some of the diseases that can actually occur with the diabetes. Last but not least, besides the glaucoma or the increased pressure, besides the retinopathy of the eyes, the diabetes can also cause cataracts to actually build in the eye. Because of the sugar, which actually in the eye, too much sugar, the body tries to get rid of it. The way the body tries to get rid of it, it can actually cause the deposits to settle on the lens of the eye, causing the lens to actually get cloudy. When the lens gets cloudy, then you can't see properly. You say your vision is blurry because you can see something, but everything just looks confuddled. So when you have problems with cataract, the only thing we can actually do is, like I said, you have the clouding of the lens or the lens. Let's say you've been in the bathroom and you take a hot shower, and you come out to look in the mirror, and you see the mirror look cloudy. That's what cataract is, just a cloud over the eye. So to actually correct that problem, we can't wipe off the eye like we could with a window. We actually have to take out. No, you can't open the door. Let it do. What we actually have to do is take out that lens and actually replace it with an artificial lens. And then that lens is a clear lens to allow you to actually see and be able to visualize better. Now, with the new lens that you have, if your sugar is still uncontrolled, then you can have more deposits on that new lens, and it can eventually cause damage to the new lens, and you may eventually need to replace that too if you get cataract built up on that eye also. So like I said, the main thing is to control your blood sugar. Once your blood sugar is controlled, then the likelihood of these happening is just the same as everybody else. So, we've discussed the 3 small blood vessels, or the problems that happen in the 3 small blood vessels. That was the eyes, the nerves, and the kidneys. Any questions? Okay. So, now we move on to the problems with the big blood vessels. The big blood vessels, like I said, blood vessels in the legs, the blood vessels in the heart, and the brain. So the 3 what we discuss is, we call it ischemic heart disease, cerebral vascular disease, and peripheral vascular disease. So this is just the heart, the brain, and the big blood vessels in the legs. So, persons with diabetes have a 2 to 6 more likely chance of developing these problems more than the general population if their blood sugars are not controlled. And these are the things that we actually want to prevent. We want to prevent strokes, we want to prevent heart attacks, and we want to prevent problems with poor circulation. And a lot of these things that can actually happen are compounded by other things. So smoking makes the problem worse. Having high cholesterol makes the problem worse. Having high blood pressure makes the problem worse. So a lot of the times we actually have to manage more than one thing, even if you have diabetes, to help and prevent these things from happening. Because it's not only the diabetes, but the other things that can also impact it and have a compounding effect and make the problem worse for persons with diabetes. So overall life expectancy for persons with diabetes, if it's uncontrolled, is about 7 to 10 years shorter than persons without diabetes. So we want your diabetes to be controlled. Once problems start to occur with the big blood vessels, that means we have to actually take better control of our life. That means we have to take better control of our sugar to prevent something from happening. Because we know if you already have a problem with a big blood vessel, means if you already had a heart attack, if you already had a stroke, then we know we actually need to manage you more critically, much better, to actually keep everything controlled, to prevent you from having either repeated strokes or repeated heart attacks. So they found, when they actually did the study, that they found persons who actually had type 2 diabetes at the point when they were diagnosed, about 50% of them, when they were diagnosed with diabetes, were also hypertensive at that same time. And also when they found out the persons who were diagnosed with diabetes, about 30% of them at that time had problems with their cholesterol. So a lot of these stuff go hand in hand or hang together. So once we see somebody who has diabetes, we make sure to check their blood pressure to make sure it's good. And we make sure to test your cholesterol to make sure it's staying within normal levels. And if not, we try to actually control it. They also did many different trials which actually showed that if you control your blood sugar, and the more your blood sugar is controlled, the less likely you are to have complications of the diabetes, or less likely you are to have heart attacks, strokes, problem with the big blood vessels. They also saw in the study that if the blood sugar is too controlled, meaning that you start to have low blood sugars, even because we have the sugars so tightly controlled, it can also cause damage. So our job is to actually control your blood sugar and keep it at the optimum level, keep it controlled to prevent you from any problems occurring. So we actually have to keep a good eye to make sure that we're keeping our target, that we're not going too high, but in that regard, we also have to make sure that we are not going too low. This just shows the persons with blood pressure between persons with diabetes, without with diabetes and without diabetes, the risk of problems in life. So it's higher for persons with diabetes. So why worry about hypertension if somebody has diabetes? Treating hypertension in somebody with diabetes can actually reduce the risk of death by 32%, reduce the risk of problems with the small blood vessels, that's the eyes, kidneys, and the nerves, by 37%, reduce the risk of having strokes by over 40%, and reduce the risk of heart failure by over 50%. So once your pressure is controlled, it actually controls you having a lot of these conditions. So the best thing, like we said, is to work with us so we can actually have everything controlled and reduce the risk of having complications. This is not to scare you any which way, but just to educate you and give you information. Knowledge is power. The more you know, the better you are aware, the better you can actually act on it. Okay. This just shows that persons with hypertension, most persons with type 1 develop hypertension several years after they're diagnosed with diabetes. Most persons with type 2, when they're diagnosed with the diabetes, they're actually found to have high blood pressure. And it actually affects at least 60% of persons with diabetes will have the high blood pressure. So the lower the target, the better in terms of your blood pressure if you have diabetes. So normally we'd say 140 over 90 for your blood pressure control. But if you have diabetes, because your risk of complications is even higher, if you have blood pressure along with it, then we even want your blood pressure under stricter control to actually prevent you from having a compounding effect from the high blood pressure.
Dr. Gomez, what is the higher number and the lower number? What do they represent?
The higher number is what we call the systolic number. The bottom number is what we call the diastolic number. So that both of them are pressures, basically. So the higher number, the systolic number, is the number or the pressure at which the heart has to contract to actually pump the blood around the body. The bottom number is when the heart relaxes. There's still some pressure still in the heart to actually keep everything pumping, and that's the relaxed pressure in the heart at the end of a full contraction to push the blood around. It just shows that with persons with cholesterol, different from persons with diabetes, as opposed to persons without diabetes, your risk of having problems is higher if you have cholesterol and diabetes, rather than just having cholesterol alone. So those persons definitely, we want your cholesterol levels to actually be controlled. In terms of target for your cholesterol, it differs from person to person, male and female, depending on what conditions you have, but generally, your total cholesterol, we usually want less than 200. Your triglycerides, another type of cholesterol, we want less than 150. Your good cholesterol, which is your HDL, we want as high as possible. And for men, we want it higher than 40. For women, we want it higher than 50. In terms of your bad cholesterol or your LDL, it differs depending on your different risk factors, if you have any other comorbidities or anything else going on, if you ever had a heart attack, stroke, or anything else like that. So we may want your bad cholesterol to be as low as 70 or lower, or depending if you have nothing else, everything else is good, we may have your target as high as 140 or 160 depending. Now, like we said, there are many other things that actually go hand in hand. If you have diabetes, that increases your risk for these problems with the big blood vessels, and that is 1, if you're overweight or obese. 2, if you have high blood pressure. 3, if you have problems with your blood sugar. 4, if you actually have problems with your blood cholesterol. And these are just problems with your platelet function and fibrinogen levels that can occur. And to actually assist with that, that's come a lot of times with persons with diabetes. Once you're over 40, aspirin is added to help with those bottom to decrease your risk of problems because of the diabetes. actually occur with diabetes is your foot. Foot problems are common with people with diabetes and actually may be severe enough to actually lead to ulceration, which can lead to infection, which can eventually lead to amputation or the foot being cut off. So they say approximately 60 to 70% of persons with diabetic foot ulcers have some type of nerve damage in the first place without any vascular disease, and about 15% of them have problems with the blood vessels. So the main thing is to actually get your sugar control, prevent you from having problems with the nerve, and that in turn will make you be able to feel your feet so you can actually prevent ulcers and everything else from happening. Not saying that if you don't have diabetes you can't get a cut on your foot. That can happen to anyone. But you need your sugar control so at least you can sense, see if you have a cut. You can actually look at it, you can check it, you can actually see if it's getting out of hand, or you think it needs to be reviewed and actually get it checked. So it can be looked at very quickly, get healed, and get back to normal as quick as possible. So like I said, the main problem is because you can't feel, and the main common sites of where it actually happens is at the back of the heels, or on the tips, on the ball of the feet, and the most common places where actually people have damage, because that's where they actually put their greatest weight on when you walk. You either step, when you step, you put your heel down, or you step on your ball, or you push off with your big toe. So all of that actually, those are the three main points where you can actually have damage. And those points are very important. And you actually need your big toe for walking. It actually helps a lot. The persons who have amputation, and even if you lose your big toe, it can cause you to have severe difficulty with walking, have to be retrained, or have to be fitted with something that actually acts as a big toe to actually assist you with walking, so walking will be actually easier. So, persons with diabetes can actually have infections, and sometimes they have a higher risk of infections. And infections can be anywhere. Infections can be of the soft tissues, that's like of the skin and everything else. You can have osteomyelitis, that's infection of the bone itself. Usually due to persons having an ulcer and it tracks all the way up through the skin to the bone, usually how it happens. You can also have problems with frequent urinary tract infections, which can actually lead to kidney infections, which you have to watch for. And especially with females, you can have frequent yeast infections. Even for the males, you can actually have the fungal infections on the skin and everything, what people call, shifting clouds or wingworms and everything else like that. Increased risk for these, especially if your sugar are not controlled. Also at increased risk for dental caries and having cavities, which can actually lead to what we call periodontal disease, problems with the teeth, problems with the gum, and actually can occur with persons with diabetes. So we need the sugar control to actually prevent you from having periodontal disease, which can actually lead to you having receding gum lines, losing your teeth early, having to get dentures and everything, which you don't want. And it can also make you at higher risk or more susceptible to certain infections, such as tuberculosis or TB. These are just some other infections that persons can actually have. So the problem with infections is because with diabetes, if the diabetes are not controlled, when anybody has any infection, the white blood cell is supposed to go and actually fight off the infection to actually help the body surmount that. What happens is that with the diabetes, if the sugar is uncontrolled, the white blood cells are more sluggish than usual, so they don't work as quickly and as good as they're supposed to. So instead of having the army hurry up, rush and go to the site, they won't go sleep. Then come the next day and say, let's go. So it actually gives rise to the infection actually having more time to generate and be worse off infection. That's like persons with diabetes, if you have an infection or anything going on. You have to make sure you get it checked out, because you have to make sure that your blood sugar is controlled and everything else like that. To make sure that you're not at greater risk of the infection being more hazardous to you, and to see if we actually need to implement antibiotics probably earlier than we would normally introduce antibiotics in somebody else. So also high blood sugars and high blood sugars in the urine may actually increase the growth of certain organisms, and like I said, can increase the severity of the infection itself. Now, with that said, persons with diabetes, if you do have an infection, cough, cold, anything else like that, a lot of times the cough and cold, that illness, can actually cause your blood sugar levels to actually be more higher than they are actually normally. The reason being is a lot of times with infection, the body has a heightened response, starts to do a lot of the things. One of the things it actually does is releases cortisol, which actually helps to get the body ready to fight off the infection, and that can actually cause your blood sugar levels to be a little bit higher than what they normally are without any infection going on. So, like we said, clock is ticking, time is going, so the time to act is now. You want to control your blood sugar, blood pressure, blood cholesterol, weight, everything else, the best time to do it is now. Whatever type of body or whatever type of position you want to be in 10, 20 years from now, you actually have to prepare for it now. So the things that you put in place, the way you exercise, the way you eat, the way you drink, if you smoke, drink alcohol, the things that you do now will actually be in preparation for you 10, 20 years from now. So if you put in bad habits now, 20 years from now, you may have more problems than you have. If you put in good habits now, then the likelihood of having bad problems down the line are much less likely, even though that may occur. Any questions?